COVID is coming to our shore. So that actually put us on high alert.
Doctor told me that you are positive COVID-19. I was so scared.
There were occasions whereby we paid, but someone else came with a bigger bag of cash.
And we decided that we would organize ourselves on the principle of leaving no Singaporean behind.
The first time I saw my son, I was so happy. Yeah, that it's over.
Pneumonia outbreak in the central city of Wuhan.
The outbreak in
11 of them in serious condition.
Early morning on the 1st of January 2020, I was officially informed that there was a cluster that is worrying and we ought to watch it very carefully.
A lot of times we read it from the public media, but we also realize the important thing is that if there is a potential transmission from animal to human and a human to human transmissions, then I think we will be really into big trouble.
It was December 31st. I remember the moment distinctly, reading about it on ProMed, which is an email listserv of people in the field, about 80,000 people across the world. I emailed colleagues in Geneva and said, what's going on? And there was clearly a lot of activity. I could just imagine the chaos, the need to try and find out more information.
We have a very close colleague who has already long time established his working relationship with the researchers in China, as well as our own colleagues locally who have built up these connections over the years, trying to get a little bit more insider information. So what could this virus be?
At the same time, people in Singapore were contacting me saying, do you know anything about this? And my answers were, yeah, it looks significant, and WHO is a buzz.
Authorities are still working to identify the virus.
The outbreak in Wuhan has affected at least 44
Everyone
people.
is wondering when the situation stabilize or even improve.
And I think a little bit of information and hint came out that this could be a coronavirus, and that was a very important message for us to be able to get our laboratory ready.
It was eerily similar to what we were getting in early 2003 about the information coming out of Guangdong about the SARS outbreak.
When it became clear that there was widespread community transmission in Wuhan itself, we knew then that this would likely impact Singapore because there were air links between Wuhan and Singapore, and so it was very likely that the virus would be coming to Singapore.
And therefore we set up a interministerial committee, basically a multi-ministry task force, in order to monitor and to coordinate a whole of government response.
But when it really crystallized for me was when I was in Davos in January 2020, and it was about 3 a.m. in the morning, Davos time, when I got a phone call, and it was Minister Gan Kim Yong on the other line telling me that we are establishing this task force, asking me to be a member of the task force. And I think from that point on, the gravity of it really sunk in.
I suppose the moment that I recall most vividly was Minister Gan Kim Yong was urgently trying to contact me. And I was at some event and I couldn't answer his call immediately. So he says, Chun Seng, we're going to have to form a task force to manage the situation. Will you be okay to join the committee? So immediately I say, sure. What do you need me to do? Just let me know.
This is a new virus. not much known about this. I remember when the task force was first set up, there were cynics and people skeptical and saying, were we overreacting? Why is there a need for a task force? But I'm glad we did it and we anticipated, set it up, because we knew that with a virus like this, potentially it could end up in a situation that would be like SARS or perhaps even worse.
Well, in the beginning, as we had our first meeting, we had very little knowledge about the disease. There was a lot of unknown, basically, and it is very challenging to try to make decisions and try to navigate our course of action in the absence of knowledge.
There was a lot of trust between us, that we knew that we had a big job to do. No question asked, we'll just get on with it and get on quickly.
Singapore has confirmed its first case of the Wuhan virus. The patient is a 66-year-old Chinese national and a resident of Wuhan.
And very soon after that, the second case was detected and was then admitted to National Center for Infectious Diseases. And we knew that from that point in time, Singapore will be into the fight against COVID-19.
And we decided that we would organize ourselves on the principle of leaving no Singaporean behind, wherever they are in the world, regardless of what situation they were in. If they wanted to come back, we would have to find a way. And because Wuhan was locked down, we had Singaporeans who were also stuck in Wuhan. So there was again another flurry of diplomatic activity, again behind the scenes, to get permission to launch what I think was one of the earliest repatriation missions into Wuhan in order to extricate Singaporeans from Wuhan who wanted to come back. Everyone on those flights volunteered. They knew they were going into a potentially dangerous situation. We knew far less about COVID-19 than we know now. So in a sense, that in fact required real courage. And I saw that in action.
I mean, I have to confess that during the call with my boss, I think there was a slight hesitation on my part initially. Anything urgent today for Consular?
Yeah, there's a Singaporean who is currently facing difficulty to return to Singapore from South America.
Does he have all his travel documents with him? My main concern then was that unlike the other consular missions, this one sounds like it's not just about me. Right? I mean, if I was infected with the virus, there is a risk that I may spread it to my loved ones. Fortunately, I think at that time my wife Joyce was next to me. She understood what was happening, so she nodded and gestured for me to proceed. On the morning of our flight to Wuhan, we were sent to SGH, where we received a crash course on how to wear our protective equipment, or the PPE. I tried to catch some sleep on the plane, but on the way there, I think it was difficult because my mind was still active, running through all the contingencies and responses. I tried to relax by chatting with the Scoot crew, and that was the time when I found out that, the entire crew for that flight were all volunteers. By the time the wheels of the aircraft hit the ground in Wuhan, the first thing that I did was to turn on my mobile phone. That was when we received the good news that all the Singaporeans who were eligible to be evacuated back had made it safely to the airport. We were not supposed to interact too much with each other than what is necessary. And we have a couple of Singaporeans who would come over to us, bring us a bottle of water, asking us whether we want to eat, because some of them have instant noodles with them. Even in such moments, our fellow Singaporeans, they themselves are tired, they are also worried whether they have the virus. they still thought of others like us. I thought that was one of the more heartwarming moments for myself and for my colleague. When the plane eventually landed at Changi, there was no sense of euphoria amongst the passengers, like applause or cheering. Actually, the mood was a bit subdued. Understandable because, one, people were tired. Two, there was still some anxiety about what comes next, the testing, the quarantine, whether they have the virus or not. And then during the quarantine itself, both myself and my colleague at separate times, we developed some flu-like symptoms. Not taking any chances, I think we were rushed off to NCID. I guess the strongest, most vivid memory must be my time in NCID, because it was a long time since I found myself in a hospital. We completed our 14 days and were finally let out on the 14th of February. Yes, Valentine's Day. When I reached home, me and my wife, we did not go for any candlelight dinner in a restaurant. We just put on our flip-flop, walked to the nearest coffee shop. I ordered my favorite black pepper chicken chop. I think we both felt that after what we have gone through, we appreciate these simpler things in life better.
Easily the most stark memory is arriving in Beijing and seeing clear blue skies, empty streets, occasional cars. You could walk down the streets, not see a person for 10 minutes. It was eerie. It was shocking to learn how this country had to respond to deal with this virus. In short, the virus had brought China to its knees. We learnt that the virus was at the highest load early on in the illness. And this was critically important because we knew that if the virus is shed in high amounts early on, and potentially even before you had symptoms, then this was going to be a disease that was spread through the community. So I knew Singapore could deal with this as well as anyone else. I also felt that other countries were particularly vulnerable, whether that's just because they lack the capacities anyway, but also did they have the mindset to be able to conceptualize what was coming their way.
And subsequently, we realized even before the symptom starts, an asymptomatic infections. And once you put all these characteristics together, I kind of knew that this is going to be a hard battle against this virus. And it's very likely that we will never be able to fully get rid of this virus.
Without NCID, I think we will be in trouble today. So I was grateful to my predecessors who have decided that learning from SARS, we better have our own Center of Infectious Diseases so that we can consolidate all the resources, build the knowledge, build the capacity, and build the capability.
Hi, good afternoon, Kings. Hi, Bo. Yeah, how is everything? And here, our closest partner is Tan Tock Seng Hospital. They inject in the manpower, allowing NCID to escalate very quickly, almost 3 to 4 times of its regular capacity. So at the same time, I would say that it is a very stressful period, but we are ready for it. we are able to band together as a team, be able to support one another. We also have a team of psychological, medically trained individuals to be able to help them. The most common issues faced by most of our staff is the long hour of work. Fatigues can set in. The other thing is that it is the fear elements. And a lot of times, I think most of our staff feels very safe, and that is our sole purpose, to provide our staff a very safe working environment. But the fear may be from their close relative or from their family members, which is very understandable because you are working in the front line, basically in a war zone, and they will have to also handle their own personal fear as well as the family.
Outside of clinical work, I also deal with preparation for mass casualty exercises, how to deal with disasters as well. And I'm also involved with MOH in terms of disaster planning. Actually, I would think that pandemics are a bit more difficult to handle because you do need a lot of endurance, you need a lot of patience to deal with the different things that it throws at you. So it's more of a marathon rather than a sprint. The first COVID-19 patient I saw essentially was a returning traveller from China. And I think the main emotion I got from her was the fear. I mean, I could see in her eyes, it was an unknown virus. She wasn't sure whether she could go back, whether there was any treatment available, what was the prognosis of the disease. So the main thing was that we had to deal with two different sites, so both the screening centre and the A&E. So there was one night in particular I remember when I was the senior doctor on night shift, and we had about 8 to 10 doctors and also the nurses as well to deal with about 300 patients in the screening centre. There were 5 different zones and 2 outside tentage areas, and it was really challenging because I think to oversee all of them, to make sure that they are actually safe and stable is really difficult. So this is the extension of the screening centre. It's really quiet now. Oh, it's so much different from how it used to be. Of course, I don't want the screening centre open again because if it opens, means there will be another pandemic that's happening. I know that if it opens, we will always be prepared, and I'm confident that we will be able to deal with the next pandemic as well.
One important lesson that we learned in the early days of COVID-19 is that every outbreak is different. You have SOPs, what we call SOPs, standard operating procedures. And every time when something happened, we always take out the SOP, dust it off and check what should we do next. Every outbreak is different, and therefore we cannot just follow the plan blindly. We must be prepared to adapt, to change, to move.
Hi, Anne. Morning. Foxy. Morning. It's good to see. So quiet, the place.
Now, I cannot go home. Even my children, they want to come here. They cannot come. So, it's really heartbreaking for me because I miss them. First time when they air it, so everybody is texting me, "Sister, you make us cry." But one thing that really struck me most is my mom, how she reacted when she watched the documentary. She really cried, as in cried very hard, because my brother is here also, and my sister-in-law is also working here. So she kept on saying, verbalizing while crying so hard and tell them to go home, tell them to go home, tell them to go home. I told her nothing to worry because the government and the management of our hospital is really looking after us.
Hello, Uncle. Eh, Pakcik. Pakcik, how are you? Let's see the word, madam. Charan. Wow. So quiet. So quiet.
Wow, I've got goosebumps.
No, I'm having goosebumps, madam.
This was where our first few patients got admitted to.
Wow, suddenly everything is flashing back, madam.
Yeah.
I can still see the patient doing
Macho,
the Zumba
macho,
dance.
Going through the conversion from a normal horse to a COVID facility was very organized madness, real organized madness. I think the first wave of patient coming in was the most scariest. It was something that I think all of us have not had experience nursing such patient before. Definitely there's a lot of anxiety, a lot of fear. But very fortunate, on our first day, we did have support from NCID, who actually gave us a lot of assurance, a lot of hand-holding to tell us that we are in the right direction.
So I remember when we are doing the exercise with them, one of the patient cried, and he's trying his best to communicate in English because I got some communication barrier. And then he asked me, "Sister, what will happen to us? What will happen to me? Am I going to die?" There's a lot of uncertainties. But you know what I answered to them? Don't think too much. Take one step at a time.
What we have done is to have a recall plan. If the hospital needs to stand up again to accept a patient, we will be able to do so in very quick time, within 24 hours. Our staff have been told who will be recalled by batches.
A few of the patients here, I think they've been here for a while. They just want to see how are they getting on these few days. Local point luôn ha, ao về cái con này ha. So moving, it was a difficult move for me because from a kampong going to a condominium sort of feeling. But it's a good move. So when I move with a positive note, and here I am now.
Currently, I still work as an infection control nurse. So activities-wise, same thing. Like for example, I'm still doing infection control audit, doing some trainings, staff education. Can you show me the 7 steps of hand hygiene?
You put either water or your hand wrap, then you do palm to palm, and then your wrist.
Definitely I'll come back. When this whole thing is over, when we have no more patients, we will definitely come back to Bright Vision. So I think what is very, very significant is the kampong culture that we have in Bright Vision is something that I can never find anywhere.
Hold on, don't let them get to you. It can't be too much longer now. To figure it out.
To tell you honestly, my plan is to go home. This is the reality. I want to be with my family. And I am looking forward for that. Because life is very unpredictable. We don't even predict this thing will happen, right? No one even predicted. But it happened. So I told to myself, maybe Donna, this is the sign for you to be with your family. Because we don't know what will happen tomorrow.
Hold on, it's almost over. I promise you'll get through.
it was self-preservation. All of us need our basic needs to survive. And when we find that there is scarcity, or we think that there's going to be scarcities of resources or supplies like food, something as basic as that, you want to make sure you have. So I think we need to understand that the kind of self-preservation is about preserving yourself and the loved ones around you. That's the first psychological factor. The second psychological factor is one of herd mentality. Sometimes you don't really need, you're not sure if you do need, but when you see everybody else doing it, you do it as well, right? So that is how the contagion works.
I'm a former TV editor who got into food production a few years ago because I saw the importance of being able to produce food where people live. I'd never seen empty shelves of vegetables before. It was quite a remarkable sight. And I think seeing that made people realise how important having local production is, because if the border's shut, there's no replacing that supply. You need to be able to supply locally. And vegetables are not the sort of thing you can store for a very long time. You can store rice and canned food and things like that on the shelves for a long time, or even frozen food. But fresh vegetables need to be constantly produced and replaced and consumed because they don't have a shelf life. Yeah, how's it going?
Doing good.
Okay. Do you think because there's been a bit more cloudy, it's slow growth, or is it been going around? So as we expand out our greenhouse capability, we need to be able to move from the 2,000 packets we're doing a week to over 2,000 packets a day, and that's going to make a significant difference in what we can supply to the supermarkets.
So even before COVID-19, we've been building the foundations for Singapore's food security. Apart from diversifying our sources, we've been raising our local production, and that's why we have the 30 by 30 goal, which is to raise Singapore's food supply to produce 30% locally by 2030. So as a response to the pandemic and COVID-19, we decided to accelerate that goal. And that's what the 30 by 30 Express grant is about, where we have high-tech farmers that are ready to raise production. We funded them to a tune of about 40 million to 9 companies, and you'll be able to see more local produce in the next 6 to 24 months.
I'd like to see us aiming much, much higher. We're trying to produce as much as we can, and I think collectively we should be aiming for 150%. And while that might sound crazy, I don't think so. I think it's important that we produce not only for ourselves, but be able to produce in a way that we can become an exporter. And then if we become an exporter, then we have a buffer. We have a shock absorber to global crises like COVID, so if the borders get closed, we can divert our export into local consumption. So this is just the first of what we plan to be many rooftop farms in Singapore. We want to do this in every neighbourhood.
So we'd like to see more of this urban farming, rooftops of vacant HDB multi-storey car parks, in commercial buildings, even like shopping centre rooftops and all that, and even industrial buildings. And why this is important is because you bring the food closer to the consumer, you cut down the carbon miles, and you cut down the transportation required to bring the food from the farm to the consumer, and that in effect can make local production more affordable in the long run.
Some of them could produce it, but they couldn't get it to the ports and the airports and ship it to us. Some of them could produce it, but they weren't willing to sell. And there was a worldwide scramble to get masks, medicine, and food. We need to activate our global supply chain networks, really to call up all our contacts from all over the world to try to secure masks, the food, the essential supplies. In fact, on many occasions, our people, both the government officials and also the supply chains players, they have to physically bring with them cash to the place the order, and there were occasions whereby we paid for it, but moments later, someone else came with a bigger bag of cash and took away what we had bought. So we could never relax until we have secured the stuff that we want, get it onto the ship or the plane, and monitor it closely until it comes back to Singapore.
Malaysia is set to close its borders at midnight to fight the spread of the coronavirus. It's the first country in Southeast Asia to impose a 2-week nationwide lockdown.
So again, if I cast my mind back to that time, I remember speaking to the Foreign Minister, Hisham, speaking to the Chief Minister of Johor, Hasni. And those conversations were also important to, update each other on what was happening. And the fact now, in retrospect, that in fact there was hardly any disruption to essential supplies.
And of course, we have our first case of an infected crew that came on board the ship in January, 1 day or 2 days just before the state of emergency being declared. That actually brought us, into sort of reality. It's coming to our shore, and at that period, there's already travelers coming into Singapore with COVID cases. So that actually put us on high alert.
I've been about 35 years as a sailor. My main role is as chief engineer. I am in charge of the engine department. Actually, we are scared, but we are only follow some protocols and protection to avoid this COVID. So now, since we arrived here in Singapore, me and my crewmates are very thankful because we are very safe here in accommodation given to us by Singapore government. After Singapore, we're heading to Port Kilang. After that one, we heading for Colombo, Sri Lanka, Ceylon.
To date now, for example, we have facilitated more than 80,000 crew changes, sign on and sign offs, and they have gone on board 6,000 ships. So I think it is for us a major accomplishment because it is not easy to balance that public health risk, protect the seafarers, protect our local population, and all this gives a commitment to the shipping industry that they can come here and do business in Singapore, and that keeps our port open, which continues to fuel the economy of Singapore. One person even told me that he has not seen his son for 1 year. He was stuck on board the ship, and he was really very glad that they were all praying on board the ship every day for a port that will allow them to do the crew change, and they were glad that it was Singapore, and he was glad that in about 8 hours time, he is going to go home and see his son.
After my 6 months contract, I will be going home to take vacation with my family, and hoping that everything will be okay. So I like this contract for my family, and we could earn much more, enough for our needs and for the future of my family. And I hope that one day or time will come, I want to visit again Singapore once again.
There was a great reshuffle of humanity occurring at that point in time. Now, although our airport was closed to tourist arrivals, one fact which people may not appreciate is that we kept Changi open and functioning as a key transit. So I recall many conversations with many different foreign ministers who wanted to get their own citizens home, and they had to transit in Singapore. I think the other point I would also emphasize when I look back at that time is when the MCO came into effect, there were many families who were desperate to go to one side or the other. And it's not about economics or jobs. Husbands or wives or parents who were ill, who were in ICU, or who had passed away, and people unable to say their final goodbyes. So there was a very, very human dimension to this separation. And again, to the maximum extent possible, we tried our best to help, to get families reunited, say their final goodbyes, either in the ICU or at the funeral. People realized that Singapore was reliable. Even in the depths of a crisis, we continued to be a key focal nodal point for the transit of essential goods, services, pharmaceuticals, food, and most important of all, people.
We did say that we hope never to get there, but the situation was such that we had to seriously consider it. And the task force debated at length the pros and cons. We knew from the beginning that had we imposed this circuit breaker, it's going to impact lives of many people and the livelihoods of many people, because the economy will grind to a halt.
It would also have impact on well-being of people, their sense of isolation, particularly for the elderly and vulnerable groups. It would have impact on children too, because if schools were closed, some parents may not have the ability to look after their children if they are in the essential workforce working, and the children may suffer. But we realized as the situation worsened, we had no choice.
We have to explain to the Cabinet, because our Cabinet colleagues are fully aware of the implication and the impact on people and economy. So we presented to them with charts and with numbers, with projections, and say, this is what we're going to be seeing if we don't have a circuit breaker. But I'm happy to say that the Minister for Trade Industry and Minister of Finance were fully behind circuit breaker, because they also know that if we don't do that, we are going to have a protracted multiple waves of infection. The impact on the economy, on the people, will be even worse.
We will therefore impose significantly stricter measures. This is like a circuit breaker.
And undergirding all of that is the point that, you needed a calm and cooperative, collaborative response from the broader society, because we were essentially asking them to do things which is out of the norm, and we needed their cooperation and compliance for it to be effective. And that is why I think the foundation of this is trust and confidence. You can only foster that trust and that confidence if you have clear communication that is provided in a timely manner, that is transparent, and coming from an authoritative source in a regular fashion. And in part, this is also, in my mind, it was influenced by experiences in the past, because very often in crisis situations, one of the concerns of the general public has been the lack of information.
There has to be a near real-time feedback to policymakers, decision makers about what the population at large is thinking. I think for COVID-19 there is this intermediate concern that some people might have a longer term health issues after recovery. So during the circuit breaker, we found that the proportion of people who saw a doctor for their illness had dropped from a high of about 90% before the circuit breaker to as low as about 50% during the circuit breaker. When we saw this, we started to probe further by launching additional surveys asking people what are the reasons or the key reasons why they did not see a doctor for their illness. Firstly, there was a group that was concerned about the length of the sick leave that they would have to undergo if they saw a doctor for their respiratory infection. There was another group which was actually concerned about catching the infection if they stepped out to look for care during a period that was supposed to be dangerous in terms of COVID spread. So we fed back some of this messaging to the Ministry of Health, and along with other inputs which I'm sure they received from other agencies, they actually undertook a messaging campaign to reinforce the need to seek care. And also subsequently, they did revise the sick leave policy.
Okay, so this is the question, why would you get vaccinated? And then all the options are listed over in text over here. I have taken the vaccine, but we have to hide until the vaccination starts. We
need to be on our guard against fake messaging. We need to figure out if the population has any concerns about the vaccine. We have noticed that a lot of our participants in past surveys have actually reported that they have received fake news or messages they suspect to be fake on other aspects about this virus. So this is one of our chief concerns as the vaccines start to be rolled out in Singapore.
Singapore has reported its first 2 deaths from the coronavirus. They are a 75-year-old Singaporean woman and a 64-year-old Indonesian man.
Our thoughts are with their families and their loved ones during this difficult moment. I decided that I had to do the announcement myself, call a press briefing, brief the press about the 2 mortality. But it is also important at that point to rally Singaporeans together, because I think this bad news will affect everybody. It's not just the family members, but the rest of Singaporeans too. I had to prepare myself because I know I will also get emotional during the press briefing.
Words are not sufficient to express our appreciation for all of those who are.
I didn't go into the parliament making a speech planning to break down, obviously. It rarely happens to me, but I recounted how I've seen so many instances of Singaporeans responding valiantly to the crisis. And I've seen so many of these instances everywhere when I go out to meet the people on the front lines. If I could allow Singaporeans to see through my eyes what I've seen, I think everyone will be similarly overwhelmed.
I was 27 weeks pregnant. My first symptom is I had bad cough, itchy throat, and lost sense of taste. I think I got it from my father-in-law. He worked in airport. That time we had a family gathering. He already showed symptom, but we really not sure he already had COVID-19 then. MOH also suggest me to pack my things and my son things and convey us to NUH because I'm pregnant. My son was different ward with me. We separated, waiting for the result. Thankful the nurse there keep auditing me. I call them. I can hear background that he's crying. That makes me more worried. The next day, doctor came to my ward. I can see that from his expression, something is not good. I asked him, doctor, is it a good news or bad news? Doctor told me that, unfortunately, Sheila, you are positive COVID-19. I was so sad. I cried. The first thing I think is about my pregnancy, and my son also was waiting for the result. After some time, they transferred me to another ward with other pregnant women. Then I was so happy, and it's less worried also because I'm not alone. They are also together with me fighting the virus together. The day we left hospital, I was so happy. What touched me is that the nurse there clap hand and say, take care, like, like that. I asked my husband to go to my in-law house. I go home, I wash my clothes, the bags all I wash, and I throw some of the things that from the hospital to make sure I really, like the virus is not with me anymore. After all that, then I asked my son and my husband to come back. The first time I saw my son, I was so happy. Yeah, that it's over. Now my daughter is 6 months old. She's healthy, and now we are going for her 6-month checkup to see her progress on height, weight, and blood for antibodies.
And how's the development so far? She's sitting.
Yeah, so far okay.
So far okay lah. Can sit nicely on her own with a bit of support lah.
Yeah. I felt happy. I think it's a blessing also. She had an antibody because of me, but she no need to go through as what I experienced lah. It's so nice to be back, to be with my family and taking care of my family. I'm back at work now as an auxiliary police officer. I'm so happy about it. In future, I want to be healthy always, work for my family and my career. I'm proud to be a Singaporean also lah. Like how we fight the virus together. What I learned is things can be tough, but we make it through, and things is getting better now.
22 new cases from the S11 dorm.
The vast majority continues to be migrant workers living in dormitories.
120 new cases.
682.
9,125.
Taking the national total past 10,000.
When we notice clusters forming in the dormitory, we are aware that it's going to be a very difficult situation to manage. So we knew that the hospitals alone will not be able to manage every patient.